Okay, welcome everyone. So now we are going to look at normal physiology and anatomy of neuromuscular junction and its importance. Why are we reading or learning about the structure of neuromuscular junction? So this is pre-synaptic membrane. This is post-synaptic membrane. This one is synaptic space. Now what happens that vesicles filled with neurotransmitter fuse with the postsynaptic membrane, come into synaptic space, and then bind with the receptor present on the postsynaptic membrane, and then they perform exert their actions like acetylcholine from presynaptic membrane comes to synaptic space, and then from space binds with postsynaptic membrane. So after binding with postsynaptic membrane, depolarization happens and it exerts its impact. Now, there are two drugs that are used in anesthesia to block the action of acetylcholine. Which drugs are there? Number one is atracurium, which is most commonly used. Another is succinylcholine or succinylcholine. Succinylcholine. These two drugs are used to act here on the postsynaptic membrane. And now normally what happens when acetylcholine comes into the synaptic space and it is binding with the postsynaptic membrane, and then it is hydrolyzed into acetylcholine for reuse purpose, hydrolyzed by enzyme that is known as acetylcholine esterase. Now acetylcholine esterase has its importance in anesthesia because acetylcholine esterase inhibitors also used in reversal of anesthesia like neostigmine. Neostigmine is used in reversal of acetylcholine esterase inhibitor in reversal of the general anesthesia. So we use neostigmine. Another medication that is used in anesthesia is propofol, which is GABA, which act on the GABA and causes chloride influx and hyperpolarization and depolarization in this way. So these are some basic mechanisms of anesthesia like acetylcholine binding with the postsynaptic membrane, and the atracurium is used, which is the non-depolarizing agent, and succinylcholine is depolarizing agent. So this is the mechanism, and we have to use these in anesthesia, and we have to memorize the dosage and their function and their normal physiology, how these drugs are going to cause side effect. Like atracurium has histamine release as its side effect. Succinylcholine has side effect of fasciculation and hypotension also there with atracurium, and neostigmine has side effect of cholinergic effect. To block that, we use glycopyrrolate to reverse the effect of choline, and in this way we use these drugs.